Welcome to Moments with Marianne. This is your host, Marianne Pastana, and we're here today with special guest, Dr. Diana Howard, who's here to share with us the back-to-school V word, vaccinations. During back-to-school season, family physicians are emphasizing that vaccinations are safe, effective, and save lives. As the number of fully vaccinated kindergartners has dropped almost 2.5% since 2020, family physicians say they have an important message for anyone with questions about the safety and necessity of vaccinations. Just ask us. Today, Dr. Diana Howard joins us to discuss the importance of vaccinations and how to have a productive conversation with your doctor to help you and your family make informed decisions about your family's health. So welcome to the show, Dr. Diana Howard.
Thank you. Thanks for the opportunity to discuss preventive health and vaccination today.
Well, we know that there's been a decline in childhood immunization rates since the pandemic began. What would you say to anyone who's on the fence about getting their child vaccinated?
Well, first, I want to emphasize that vaccines work. They are safe and effective and save lives. And the reality is that most of today's population does not remember what life was before vaccines. They have saved millions of lives and they have critically advanced public health. Vaccines have been subjected to comprehensive scientific research and testing before they reach the public, and they have several safety checks. So getting vaccination will also protect the most vulnerable people. If someone mentioned that they don't want to get vaccinated because they have a good immune system, I will tell you that you will protect those who can get immunized. So we're talking about newborns or anyone who has a weak immune system. We will create a community of immunity.
Well, it's interesting. I know there's been a rise of measles across the U.S. What's behind the increase and how can parents protect their children?
Well, I would like to mention two facts. One, the measles is the preventable disease, means that you can get a vaccine that will prevent you to develop severe symptoms, to be hospitalized or die due to that. And second, the measles was eradicated in the US. We didn't have to worry about it because we had vaccines. Now, unfortunately, because of the childhood vaccinations rate have been falling since the pandemic, now we opened the door for new outbreaks of preventable diseases just like measles. This had led to children to be hospitalized. Now we have 2 deaths due to that. And it's not because they didn't have access to the vaccine, but because they chose not to. So now our parents need to know that they have the power to protect their children. They can have an update of their vaccines during their well-child visits or any visit with your family medicine doctor. Get your MMR vaccines. You will protect not only your child, but the people around them.
So, for parents that aren't even sure if they had a vaccination for the measles as a child, can they get that now?
Absolutely. We can provide vaccines right away. And even for adults that they are unsure of their prior vaccination, we can order blood work to double check if they have immunity. And if they don't, we can provide vaccinations to all.
Oh, that's so good to know. I know there's so much on social media and just discussion in the media itself in regards to vaccinations and health. So, when it comes to vaccinations for patients, especially of all ages, how do you help patients separate the myth from the fact?
Well, as family physicians, we know that our patients and their families, when they come into our clinic, they want to do their best for their families. So it is confusing, it is overwhelming to go through all the information that is in the media and cut through the noise. But your doctor can help you answer all those questions, and we will provide scientific-based information to help you make the best decision for you and your family's health. Now, the best thing we could do is just reach out to your family doctor. You can have a conversation, bring all those questions, all your concerns. We were there to help.
So, are there common myths that you're seeing as a doctor that are coming into your office?
Yes, we have multiple myths and questions about how effective the vaccine is. And so we talk about each of them. We talk about what is the research behind, and we also clarified any misleading information, especially when even we have questions about autism, that we have no scientific-based information that can prove that. So we can assure our patients' safety and their parents as well.
That's so good to know because there is a lot of chatter about how there's this connection between autism and vaccinations, but that seems to be something that's just not true.
Correct. Yes. And we can answer any other questions that they have.
That's so empowering. People can go to their doctors and get the real information. Now, we all want to be advocates for our family's health and to do the right thing for ourselves and our loved ones. What questions can family doctors answer about vaccinations?
So, as family physicians, we take care of the newborns, we take care of adults, we take care of the elderly. So, we can tell you which vaccine is the appropriate for each member of your family and when is the right time to get them. We can answer all the questions about vaccines and safety. We can talk about side effects, that most of them are mild. And it's actually a proof that your immune system is responding to the vaccine. That means that the vaccine is working in your body. We can encourage anyone to bring all those questions of vaccines with their family physicians. We want you to be the best advocate for you and your family.
That's so important. It's having that relationship with your doctor. So, what vaccines are most relevant for children returning to school this year?
Well, it depends on their age. So we need to follow the recommendations based on the kid's age. And also, we have to check on the prior vaccines. So now at this point, we have to think about the flu vaccines because that's the flu season. And we also talk about RSV. So it depends on the kiddo's age and also if the vaccines around the family has been provided. So we encourage not only the children, but their families to be vaccinated.
So, how is a vaccination schedule for children determined?
So it's based on their age. So we have some vaccines that are provided since they are newborns. So the first day they can get a hepatitis B vaccine, and then the next vaccine will be when they turn 2 months, then 4 months, 6 months. So we have a schedule that will follow along their life. So if we have, example, a child that has missed a few vaccines, we have a different schedule that we call it a catch-up vaccine schedule. So we will make sure that they are up to date with their vaccines before they go to school.
So, you kind of touched on this a little earlier, and I want to dive a little bit more into it. What is the role of vaccines in maintaining a really healthy community?
Well, whenever we receive a vaccine, even if we have a good immune system, we will not only protect ourselves, but we will protect those that who can get vaccinated. So we will create this community that has not only protection for those that who developed immunity with the vaccine, but those who can have access to it. So we are talking about newborns. We are talking about pregnant patients. We are talking about anyone that is immunosuppressed. So is the effect of the vaccine not only for those who receive it, but those who are around.
So, how can patients and parents begin a conversation with their doctor if they have questions about vaccines?
I think that we, as family physicians, are open to have any discussions about preventive health. So, talking about vaccination is part of it. So, you can just bring what vaccines are recommended for me, for my age. You can just bring an open discussion. You can go to your doctor for your annual physical, which means that you don't need to be sick to go and see us, to just go for your preventive health visit. Vaccination is the top of the line. So we can discuss openly which one will be the best vaccine for you and your family. And so it will vary. It will vary according to which vaccines you received in the past and which one will be the best for the time. So example, now we talk about RSV vaccine, we talk about influenza. It depends.
Well, if people are looking for more information about vaccines, where can they find those resources?
So the American Academy of Family Physicians has a website with further information, great resources for our patients and their families. Is familydoctor.org. We have information in Spanish and English.
Oh, that's really great. So people can go there and get more information. What would be like a number one like tip you want to leave for our listeners today?
I want you to know the vaccines work. They are safe and they are effective. We save life with vaccinations. You have the power and access to have vaccines around you, not only to protect you, but your loved ones. And if you have questions to discuss, your family physician will be there for you. We want you to be the best advocate for you and your family.
Such great advice. Well, Dr. Diana Howard, thank you so much for taking the time to be on the show with us here today.
Thank you very much.
To connect with Dr. Howard and be part of her community, visit familydoctor.org. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Marianne, where we make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmarianne.com for more information.